Continue being in that. Wonderful. Thank you. Again, thank you all for joining. This is January 2024 Information Exchange meeting about arthritis. It's only an hour-long meeting, and I appreciate that you may all have questions. In case we don't get to ask all your questions, we will definitely forward them to our speakers today. Please feel free to use the chat box to raise your hand if you want to ask a question, and we will respond to that as soon as we can during the meeting, if not after the meeting. Yes, I won't be taking any more time, and I'll give the word to Bethany, Bex, and Mel from Versus Arthritis.
Morning, not morning, afternoon, everyone. The day's gone so quickly. Just want to introduce ourselves. So my name's Bethany Diprose. I am a Senior Manager at First Arthritis, supporting our commissioned and institutional services. I'm also joined by my colleagues Becky and Mel, so I'll just pass over so they can introduce themselves too.
Good afternoon, everyone. My name is Becky Shipley. I'm the Programme and Partnership Manager for London and the South of England. So I oversee our adult services that we provide in the South of England.
And hello, everyone. I'm Mel Rochford. I'm the Senior Partnership Manager for Corporate and Commercial at Versus Arthritis. So I will be doing a lot more of the listening rather than the speaking today. Very happy to chip in. Always keen to hear if there are any corporates in the area who are interested in forging links with us, because as we know, there are so many people affected by arthritis, 1 in 6 of the population, and so many employers actually have many employees struggling with arthritis or MSK issues, a lot of the time under the radar and not feeling that they can actually step forward and reach out for the help they need in order to work comfortably. So I'm very happy to be here. I've also lived in the Hackney area for 15 years. I'm now in Tower Hamlets, just down the road. And I know that this is a big area that affects the local population. So I'm glad to be here today.
Is there any way you can turn it on?
Thank you both. So what we're going to do now is to start to share.
Ask you to mute it, sorry.
Oh, sorry. I think, sorry, Sheila, I've got you on. Yeah. So we're going to share our slides this afternoon, just with our short presentation about arthritis awareness and support you can get. And we'll also be working with Kirsten, who's on the call. We'll be able to introduce herself in a bit. So let me just share my screen. Fantastic. Can everybody see the beginning of the presentation? Oh,
Me, I don't think you're at the beginning.
Apologies. So, I think the first thing would be just for us to give you a little bit of information about Versus Arthritis and who we are. So we are a UK registered charity, and we are the largest UK registered charity specifically supporting people in community with arthritis. Our vision is to support a future free from arthritis. And our mission is to ensure that we won't rest until everyone with arthritis has access to the treatment and support they need to live the life they choose, with real hope of cure for the future. To deliver our mission, we invest in world-class research, deliver high-quality services, and campaign on the issues that matter most to the people with arthritis. So to give you an idea, last year we supported 18,000 people with face-to-face support, and we also received 11,000 calls through our helpline supporting people with arthritis who needed information and support from us. So to start off, what is arthritis and why is it a problem in the UK and for our communities? So to give you an idea of the scale of the problem, in the UK, there are 10 million people living with arthritis. That's 1 in 6 people. So 1 in 6 people that you know, or even yourself, would be living with arthritis and the day-to-day symptoms and challenges that come with that. Out of that, we've been able to draw information on the split between men and women who actually suffer with musculoskeletal conditions, or what we call MSK conditions for short. So 11.6 million women have MSK conditions and 8.7 men have MSK conditions in the UK. And we've also just included some stats there to raise awareness that arthritis can affect anybody of any age. So 15.4% of people with arthritis are actually aged under the age of 35, with 51.1% aged 35 to 64, and the remainder being over 65. So it really can impact anyone at any point in their life. And to bring it into Hackney on a bit more on a local basis, we've been able to draw some more local data to give you an idea of what your neighbours and your communities are kind of dealing with in the local area. So currently within Hackney, 11.8% of adults are living with a long-term musculoskeletal condition. And just over 6,000 of those people have hip osteoarthritis, and over 10,000 people living with knee osteoarthritis. So it's likely that someone you know, or even yourself, will have arthritis currently living within your community. We've also found as well that 18% of adults living in Hackney are physically inactive. So that means not doing physical exercise within the sort of remits that sort of would be included as being physically active, or classed as being physically active every week, which is a key driver and risk when it comes to developing arthritis or being able to cope with the symptoms of arthritis. So what is arthritis exactly? And it can have many different names, and there's a long list of conditions, but we've just included a few and a very, very quick sort of roundup of what arthritis is for you. So arthritis can be described as pain, swelling, or stiffness in the joint or joints, multiple joints. Arthritis can affect any people of any age, and it can also affect children. Although there's no cure for arthritis, treatments have been used, especially in inflammatory arthritis, and there's clear benefits in starting the treatment at an early age. And it's often really difficult to identify the cause, but there are several reasons that can increase risk, and I'm sure that will be covered later on in the presentation this afternoon. And also symptoms of arthritis can vary. So one experience of arthritis from one person to another can be completely different, and therefore their treatment needs are different and the challenges that they experience are very different. So, you know, when we're thinking about arthritis, we really have to support people on a person-by-person basis. It's very personal to them. And just a quick list of the different types of arthritis. Some you may already have heard of, likely osteoarthritis, which often happens in the knee, elbow, shoulder, and hip joints. And there's also rheumatoid arthritis, which is an inflammatory response. And also a few there that you might not have thought of. So carpal tunnel syndrome is in the arthritis family, as is gout, and a few other related conditions such as lupus can also include symptoms of arthritis quite commonly. So we just have a short video to show you, and then I'll pass over to my colleague Becky, who will just give you a bit more information about arthritis.
What is osteoarthritis? Osteoarthritis is the most common type of arthritis. It affects around 9 million people in the UK and is more common among women. In most cases, people are over 45 when they get it. It can cause pain and stiffness in joints. The most common joints to be affected are the knees, hips, back, feet, and hands. To understand what happens in osteoarthritis, let's first look at how a healthy joint works. A joint is where two or more bones meet. They allow bones to move freely without letting them move too far. A joint is held together by a capsule and ligaments. There is a soft inner lining to the joint called the synovium. A thick fluid is made by the synovium, which protects the joint and helps bones move freely. Thin layers of tough, slippery tissue called cartilage act as a protective cushion to stop bones rubbing against each other. Muscles are attached to tendons, and tendons are attached to bones. Our muscles pull our tendons, which in turn pull our bones. Osteoarthritis starts when cartilage starts to thin or roughen. This can happen naturally during the aging process. There are also things that can make this more likely to happen. For example, being overweight or an injury. Once the cartilage has started to thin or roughen, the body puts in place a repair process to try to make up for the loss of cartilage. The repair process may work well, but can sometimes cause further problems. New bits of bone may grow within the joint. Extra fluid can also build up inside the joint. The extra fluid and the new bits of bone can cause swelling and may force the joint capsule out of shape. If you have osteoarthritis, try to maintain a healthy weight and keep moving as much as possible. Exercises to strengthen the muscles around the joint can improve symptoms of pain and stiffness. Taking painkillers can help you stay active and exercise. It can be tough having osteoarthritis. However, remaining physically active and continuing with your hobbies, normal routine and social life can help you manage your condition.
Over to you, Becky.
Great, thanks, Bethany. You can move on to the next slide.
Oops, sorry. Oh.
You press the little arrow down at the bottom.
Yeah, sorry.
All right, and then skip again because we've had the video, so lovely. So that little bit of information, that little video told you a little bit about osteoarthritis. I'm just going to give you a little bit of information now about rheumatoid arthritis, which Bethany mentioned earlier. So rheumatoid arthritis is a condition that can cause pain and swelling and stiffness in joints, like many other types of arthritis. What makes rheumatoid arthritis different from something like osteoarthritis is that rheumatoid arthritis is an autoimmune condition. So this means that our immune system, which is the body's natural self-defense, can get confused and can start to attack your body's healthy tissues. So in rheumatoid arthritis, the main way that it does this is with inflammation within joints. So the main symptoms of rheumatoid arthritis are joint pain, joint swelling, warmth and redness, stiffness, especially first thing in the morning, or if you've been sitting still for a long time and not moving, that can also create stiffness. Rheumatoid arthritis can affect any joint in the body, though it is often felt in the small joints in the hands and feet first. And normally both sides of the body are usually affected at the same time. So normally you'll get it in both knees or both ankles or both wrists, whereas with osteoarthritis, you may only get it in one knee, one hip, one hand, things like that. But in the same way, this doesn't always happen, but that is the usual for what happens with rheumatoid. And I think I'm now going to pass over to Kirsten.
Thank you, Bethany. Thank you, Becky. Very, very useful. And I'm sure Kirsten will be brilliantly topping up on what you said as well with some local information and insider information as well. Kirsten, over to you.
Thank you. So yes, my name's Dr. Kirsten Brown. I'm a GP in Hackney and I've been a GP in Hackney for nearly 20 years. I work in the north of the borough at Spring Hill practice, and I'm also the clinical lead for primary care in City and Hackney. So yeah, I just wanted to give a more local flavour to the management of different forms of arthritis. Obviously, the details about arthritis have been covered really brilliantly already. So what happens if you contact your GP surgery with joint pains? Well, the first thing is you're most likely to be offered an appointment either with your GP or with what we call a first contact physiotherapist. So this is a very senior physiotherapist who can do an assessment on joint conditions such as arthritis. And we have first contact physiotherapists in most of our practices across City and Hackney. So you would come in and see that practitioner, either the GP or a physiotherapist, who would then do a clinical assessment, which is about taking a history from you about the problem and also then doing a clinical examination. Sometimes that's all that's needed to make a diagnosis, and it's clear from the history and examination what kind of arthritis you have and what the best next steps would be. Sometimes further investigations are needed. This might include imaging, and by that I mean X-rays or scans, and these can be organised at our local hospital. Sometimes if we are thinking about an inflammatory arthritis, and by that I mean some of the arthritis we talked about, such as rheumatoid arthritis or gout, we may want to consider getting blood tests done as well. And then through a combination of those, the clinical assessment and potentially some of those investigations, hopefully a diagnosis can be met. Once the diagnosis has been made, then that will help decide what next should happen to help you manage your arthritis. If the GP considers or the physiotherapist considers you may have a condition such as rheumatoid arthritis, you may then be referred to our rheumatology colleagues at the local hospital. And they manage these conditions often with medications which are prescribed through the hospital. If your condition is thought to be osteoarthritis, which, as you've heard, is the more common of the condition, arthritises that we see in practice, then this is often managed within primary care. We've heard today, really the primary thing about managing osteoarthritis is staying as active as you can, and your GP practices can help you do that. This may be signposting you to local exercise groups, and at many of the GP practices, such as myself, we have exercise programs run by volunteers in the practice in our surgeries. These might be walking groups and sometimes even seated exercises for people who really can't, who are very immobilized by their arthritis. There are also lots of activities that happen across the borough. In Hackney, in the summer months, there are activities that happen in the local parks, which are all free of charge. You can also be referred to your local gym by your GP or a healthcare professional in your GP practice to help you get more active again in the gym and do an exercise program through the local gym. Sometimes you may be given exercise programs by the physiotherapist or by your GP to help you do exercises at home, which can be targeted on certain joints, such as knee pain or exercises for hip pain. Sometimes people aren't able to manage to do these exercises at home and they need a little bit extra support. So at this stage, you may be referred onto our locomotor service, where we have a physiotherapy service where they can offer you ongoing physiotherapy to try and get you more active and really use some targeted exercises around the joints where you are struggling with, and to get you as mobile as you can. Because as we keep saying, activity is the main way to manage osteoarthritis. We've touched on pain relief, and of course pain relief is important. Managing pain, though, it can sometimes be really difficult when it comes to chronic pain that people suffer with osteoarthritis. In the first instance, people, I'm sure your GPs would be encouraging you to use simple painkillers such as paracetamol, and also then topical anti-inflammatories, which you can rub onto the joints. These medications are the least, are likely called the least side effects and the least harmful. So these are probably the ones that would go to in the first instance. Sometimes we use anti-inflammatory medications. Not everyone can use those. These include ibuprofen, naproxen. Not everyone can use these medications because of various other healthcare conditions, but they can be really useful to use in acute flare-ups of arthritis. Sometimes, again, in acute flare-ups, we use medications called opioid medications, such as codeine. These are often prescribed with paracetamol, such as cocodamol. As GPs, we need to be really careful about prescribing these opioid painkillers because they have lots of side effects, and they can become quite addictive, so you become very dependent on them. So it's really important these are only used for short periods of time when you're suffering from acute pain. So we would never want patients to end up on long terms because they do become dependent. Patients do become dependent on this, and this means that first of all they stop working so well, and often you need more and more to take more and more, and so you really can become quite dependent on these drugs. So we like to avoid these in long-term pain. Finally, if you have osteoarthritis and it's severe in certain joints, you may be referred to an orthopedic surgeon, where they would consider doing surgery such as joint replacement. This is often the sort of at the end stage, but it can really be transformational for some patients. So I'm going to stop there, but happy to take any questions about local services or the management by GP practices of arthritis.
Thank you very much, Kirsten. That was really, really useful. And I think just to wrap up on what you said, the messages that, we got from you today is that if people come to the GP practice with this complaint, they may not see the GP necessarily, but they may be seen by another professional. Then the next one is about the painkillers. They're not always, you said it better, but obviously not every painkiller is good to be taken for a very long time because that will stop helping patients, obviously. And then stay active. Really, that's the best thing that people can do to help themselves, right? Yes, with that, you're on mute.
Absolutely, staying active. I can see some messages popping up about chronic pain, and chronic pain is a whole nother topic, which may be one that would be useful to discuss at one of these forums. But briefly, I think the management of chronic pain has to be holistic. So we have to look at the whole patient and think about what their goals are. We do have pain services, and we also manage a lot in primary care alongside our colleagues such as health and wellbeing coaches, social prescribers, and of course that GP and patient relationship working together. But the management of chronic pain, it has to be holistic, and it has to be individual for that patient and their needs. But often medication isn't the answer.
Yeah, and Bethany, Becky and Mel from Versus Arthritis will continue after this with their presentation on managing symptoms and, how to live with it. But we'll take a few questions. Caroline, I can see you raised your hand.
Yeah, hi. I did raise my hand and I thought
Right.
I'd left a message for everyone in the chat, but something's not quite right. I might have just messaged Fabian there. Many mistakes there. Apologies, Fabian. Right. My question is that, thank you, Kirsten, for that information. Unfortunately, what you've said doesn't actually happen like that on the ground for patients. I've had my arthritis for over 10 years, and I have resorted to using my own funds to pay for my own my own physiotherapy, alternative pain. So I think that's not quite right what you said, certainly from my experience and certainly in my surgery. The second thing is that it's really easy to say that, maintain your weight and do your exercise. It's really easy when you're bedbound and you've got no mobility, and it also has a kind of psychological effect. When that's all at place, it's really difficult. I think the best thing we could be told is realistic. Is that our expectations are managed, because we go to physio. I stopped going to physio now once a month. I love the physio team. They've made me walk again, but you go there and you leave exactly the same. So I'm sorry, like I want to be positive, and I am, because I'm actually going to have a knee replacement in the coming weeks. But I know what I have had to do to get myself walking, the amount of money I have spent on treatment for myself, which is great. I can do that. Not everyone can. And I think we need to talk about alternatives, you know, alternatives to codeine, alternatives to opiate based, because I was told I wouldn't be getting any more. So just what I just wanted to say that. And I thought I'd said it in the chat, but hey, apologies if Fabian, if you got that.
Thank you, Caroline.
Yeah, Caroline, I think you're absolutely right. We do. I really think it's really important to manage patients' expectations about different, and of course, there's a whole range of different levels of different degrees of arthritis, and different, you know, people are suffering in different ways. And I think, you know, that we have to say that to begin with. I mean, that some people, there's a whole variety of different patients and the way they present. I think when you're suffering with chronic pain, it really is important to take a holistic approach and think about the psychological aspects, as you've talked about, and talk about, you know, the patient's individual aims and expectations as well. And that's what I would be wanting and expecting GPs to do. You know, I appreciate that I can't talk on behalf of all GPs. I'm talking from my own personal experience and how I would manage a condition. And I appreciate it. The way everyone's experiences will be different, because they're different. You know, we're all different practices with different GPs. But I guess this is the way I would approach a patient's journey.
Thank you, Kirsten. And I should probably remind everyone here, if they feel that you know, the services are not meeting patients' needs, or they don't feel quite satisfied, please do get in touch with us and, you know, share your feedback with us, because more we know, better we can do, and better suggestions for improvements we can make. And Greg, I can see you raised your hand, but I would like to take one question from the chat box. What do you recommend for someone in pain for over 10 years if you say medication long-term is not great? Kirsten, would you be able to?
Sure. So I think we talked about, you know, the management of chronic pain is very individualized. You have to think about the individual. You have to take a holistic approach, as we've talked about. So you look at the patient as a whole and think about what their aims and expectations are. And I think, you know, the last question, I think it was Caroline was saying, you know, managing someone's expectations is really important, and breaking it down and thinking, right, what's really important at the moment for that patient? And, you know, also having a realistic discussion that there may not be a way to get rid of all of the pain, but there is ways that we can manage pain and we can approach it in a way that can make people's lives better. So it's about taking that holistic approach and thinking about things from a not just a very medical approach, but also a psychosomatic approach. So what I mean by that is a psychosocial approach, so a psychological and the social aspects of how that is impacting on their health. We can have support from the pain clinic, who also do take a holistic approach, and that's the pain clinic is run by our local locomotor service.
Thank you, Kirsten. Greg, would you like to go next?
Yeah, hi. Thanks very much for that. It's most informative. About 12 years ago, I had arthritis in my right shoulder, which, after going through physiotherapy and the usual process, GPs, etc., I had it was seen to surgically on the NHS. And since that time, no problems whatsoever. It was, you know, an entirely successful surgery, and it's still great. Over the last year, arthritis has developed in my knees, and I'm just wondering, I get the feeling that knees are a little more complicated than shoulders, but if eventually I'm doing, you know, I'm trying to keep active and strengthening the joints and so on, but in case that doesn't work, is surgery an option or not?
Absolutely. We certainly do both GPs and our local motor services and the first contact physiotherapists in our practices will certainly refer to orthopedic surgeons at our local hospital if it's felt that the joint is at a stage where surgery would help. And that would be a conversation we would have with our patients. So if it was something that we would, you know, if surgery is something they wanted to consider and the assessment is that might well help them, we would then refer on to our local orthopedic surgeons in one of the local hospitals.
Yeah.
But generally, that's sort of an option of last resort, or is that you know? And regarding my question is, are knees less apt to be surgically treated than shoulders, for example?
I think it really depends on, like Craig, it really depends on the individual thing. I wouldn't want to go into individual. From a knee replacement is a big surgery, yes. And if you're looking at osteoarthritis in the knee, you're generally looking at a knee replacement. But I am not an orthopedic surgeon, and I don't want to talk about that.
Okay, all right, thank you.
Thank you. And Kirsten, I know that you have to go shortly. Are you okay to take one more question, or shall we?
Yeah, no, one more question will be fine. Yeah.
Sure. Jacqueline, just very quickly, if that's okay. If not, we'll take it to Kirsten later after the meeting.
Yeah, I also have osteoarthritis. I've had that for more than 12 years. Excuse me. And I'm due to have surgery, knee surgery. But the thing I most was concerned about was that in all the time I've been on the waiting list, I've never really been offered any kind of physio or, you know, anything like that. It's something I've had to source myself privately because I've just not had anything. And I just wondered, you know, is that something that can be put in place? If someone is on the list for surgery, could they not be referred to someone, to physio? Is it something that they, you know, it should be something that just happened, I think.
Like in the meantime, between the surgery, before the surgery, you mean?
Before the surgery, because yeah.
Right.
Yeah, before the surgery.
Will that not include like any signposting information that the referrer should provide to patients, or something to come from the hospital? Like, this is what
something should happen. I mean, either from the hospital, they should refer me on to somewhere else, you know, to support me while I'm waiting for that surgery, I think. But I've had nothing.
So I mean, again, it's really about individual cases, and I don't want to I would know your individual case, but I think that sometimes arthritis, you know, it depends how severe the arthritis, and it maybe it's been made. Sometimes maybe physios feel that there is little progress they're going to be able to make when it's at a certain level. That's, again, I'm speculating. I don't know.
Yeah,
I think there is always, you can always be referred to a physiotherapist. Every GP practice in City and Hackney has access to refer patients to a physiotherapy and physiotherapists. So they may not have them in there. Most of them have first access physios in their practice, but every practice can refer to the locomotor service. And I know that 100%. So patients can certainly ask for referral to locomotor service where they can see a physio. And that's for sure. There is, interestingly, there's a move within the NHS to start to allow direct referrals, self-referrals from patients for locomotor. And even at the Homerton, I'm aware that you can actually refer yourself to the locomotor service through the physio, to see a physio directly, even without going through your GP, and that's something that's being rolled out nationally. Some of the as a service. So I would say yes, that you should be able to see a physio even on the waiting list. You may see that physio and they may say, look, there's really not much we can do at this stage, but you should still be able to have that physio assessment if you feel, if that's something you would want.
Thank you.
Wonderful. Thank you, Kirsten. And I appreciate that you the rest may have questions for Kirsten. Please put them in the chat box, either as one to be seen by everyone, or like a private message to me or my colleagues, and we'll pass them on to Kirsten. We'll respond back to you appropriately. But Kirsten, thank you very much for your time. Much appreciated. Wonderful information, very useful. And I'll talk to you later.
Yeah. Okay. My pleasure. It's lovely to see everyone.
Thank you very much.
Bye now.
Thank you. Yes, Bethany and colleagues from Versus Arthritis will now continue with their presentation on managing symptoms, managing arthritis, which I believe will be very useful as well. You okay to continue, Bethany? Good, thank you.
Waiting for, there we go, slides to appear. Lovely, thank you, Bethany. Can I have the next slide, please? So it's already been kind of talked about. Kirsten has spoken quite a bit already about keeping moving and how kind of important that is. We do recognise at versus arthritis that it can be really hard to keep moving when you have arthritis. You know, someone mentioned kind of being bedbound or being, you know, struggling to walk and things like that. And we, you know, we do recognise how challenging it is when you do have arthritis. But staying as active as possible to you can reduce pain and symptoms and help you to stay independent. As well as reducing pain, exercise can improve muscle strength, which keeps your joints strong and well supported. And if you are looking at joint replacement surgery, or if you are on a waiting list, then trying to build those muscles around those joints that you're going to have replaced, if you're having like a knee replacement or something like that, trying to build those muscles around those joints can really help you kind of in the long term with kind of joint replacement. It can help reducing stiffness in joints. It can help balance and improving energy levels and feeling of tiredness, and can help you manage your weight and boost your mood. And people often get a bit worried about kind of keeping moving and think, oh, we've got to, you know, run a marathon or anything like that. I can't run a marathon. But even just little things like, you know, something simple like if you're sat in a chair with your feet kind of on the ground, if you can lift your leg kind of forwards and straighten it as much as possible, if you hold that for up to 10 seconds. If you can only do 2 seconds, that's fine to begin with, and then put it back down. That is going to be strengthening all your muscles in your leg. Doing that just a couple of times a day can help kind of with that, you know, that counts as keeping moving. Thank you, Bethany. Next slide. So some things that we have at versus arthritis, I noticed my colleague Mel did put a link to one of these in the chat a moment ago. We do recognise that sometimes it's hard to get out. Kirsten did tell you lots of wonderful things that sound like they're local and face-to-face for you in Hackney, which is wonderful, that you've got all those different opportunities for kind of keeping moving. But if you're struggling to get out the house, or if maybe you work or you can't get along to some of those face-to-face things, at versus arthritis, we do have a number of exercise and keep moving things on our website. We have a series called Let's Move with Leon, which is a 12-week program of 30-minute movement sessions. Leon is a fitness instructor, and he does it with his mum, who has osteoarthritis, and so they can show different ways of doing kind of the stretches and things depending on your mobility. We have a full body stretching videos that are available on the website as well. And as Mel put in the chat, we do have a surgery toolkit. In the toolkit, you'll find tailor-made follow-along exercise routines for hip, shoulder and knee replacement. Those are the kind of 3 most common forms of replacement at the moment, as well as full body workouts to help you maintain overall fitness. So if you are struggling to get out, or you can't get to one of the face-to-face ones, I know in winter I find it really tough to get out and about. So if just kind of doing maybe a couple of stretching videos for a little bit at home, if that will help you, do have a look at our website. We'll put the address up shortly. Thank you, Bethany. And then just a couple of other things to tell you about how we support people with arthritis at versus arthritis. So we offer free information, easy to read health information booklets that can help you understand conditions, find out about available treatments, and learn how to live well with symptoms. We have a free helpline. It's staffed by experienced and caring advisors who are here to offer support when people need it. Our helpline is available Monday to Friday, 9 till 6. They're always there to chat, even if you haven't got any questions or you just want to chat to someone. They love having a chat, so do kind of, you know, do give them a ring. It was mentioned earlier about the kind of holistic and how actually living in pain can really affect your well-being and anxiety and things like that. And our helpline staff are kind of trained to chat through things like that if you are struggling. So do kind of give them a ring. Our online community, if you're online and you like kind of chatting and these kind of things and these the kind of chat groups. Our online community is a safe place to meet people with arthritis and people who care for or support them. It's a great place to share experiences, to get that kind of peer support as well, and to ask any questions. We do also have peer support groups. Currently, unfortunately, we don't have one in Hackney. Our closest one is currently Enfield, but that is something that we are looking at growing. We, as a charity, are currently going through a review of our peer support groups, and it is part of our plan for the next year to grow this. So we would love to see peer support groups popping up all over London, and particularly in Hackney. So if you are interested in maybe volunteering with us to lead a support group, do kind of get in touch. And also, as we mentioned, arthritis doesn't just happen for people who are older. Young people also do get it. You can get it of any age. And for our young people aged 13 to 25, we have an arthritis tracker, which helps young people kind of record their symptoms and things like that, which can then help them when they go for appointments with their GPs to be able to kind of look back and see kind of how they've been and when they've maybe struggled more. We are looking to build that to be available for anyone, so not just for 13 to 25s. That is kind of still in motion, I think, at the moment, so that's not currently available. But if you do know anyone who is 13 to 25, they can access our arthritis tracker. And I think that's it.
Thank you very much. Thank you, Becky. Thank you, Mel, and thank you, Bethany, as well. All very useful information, and we'll go through the chat box to the chat, the questions and comments in the chat as well. Just before we do that, you mentioned about online support, and just give us a call if you wanted to talk to someone. I wanted to check whether this support is available in different languages, first of all, because Hackney is quite diverse borough, and some people who have English as their second language would not necessarily speak English.
Yeah, so we have a translation service that we do use. So it might be that we have to kind of rearrange and kind of phone you back to make sure we can get somebody. But yes, we do provide translators.
Wonderful. That's really good to hear. And now I'll read a few of the comments or of the questions here. We have one: after a course of steroids, we are now talking about fusing bones in my wrist. How effective is this operation? Are you guys able to respond to that?
We're not medically qualified, so we wouldn't be able to, I'm afraid, answer questions of that nature. What I can say is that a big part of our work is in research. Versus Arthritis have a huge team and put a lot of funding into the academic centres of excellence right across the UK. About 10 centres that we provide a very significant amount of funding towards to help in all sorts of various fields of research relating to arthritis, and that does also include research into pain, which is very sadly palpably clear is a huge issue for so many people living with the condition, and I think also in its chronic nature. So we are very, very aware of the difficulties there. So sadly, we wouldn't be able to provide advice on that. Anything medical we can't do.
No, fair enough. Thank you. Lorraine, I can see you raised your hand.
Yes, hello, and thank you very much for this platform. It's been very very full of information. I'm age 58. I had a knee replacement when I was 48. It'll be 10 years this September, 11 years, sorry. It stemmed from a child accident when I was 13. I shattered my right knee and hip, and it's affected my life ever since. I've always had a prominent limp. Hence to say my left leg, which is classed as my good leg, has taken the toll from the right leg. The right knee, when I had replaced, I had to lose 4 stone to have it, because I've always had a weight problem, and I did manage that, and I've managed to maintain my weight since, though I'd love to lose more. They were going to suggest a bariatric operation, but in the end, because I lost that 4 stone just over on my own, I was allowed to have the knee replacement at the Royal London Hospital. Now, it doesn't take away pain, but it certainly helped me be more mobile. But my left leg now is starting to go on me, and lots of cracks, the locking of the knee. When you stand up, you get the lock in there, the rubbing, the swelling on the knee. I've got all that. I understand all. Slight fluid in the ankles if you're on your feet too much. And it's got to the point where I have no energy. I got cancer in 2022, lung cancer, which I'm on chemo. They managed to get it all with surgery, non-smoker, but I got it anyway. And I've always liked to be active, like in the gym, walking. But for some reason, the pain in my leg, and I get it in my hip as well, my left hip and my left knee, it really does cause me absolute bad pain, really bad. And yes, my GP prescribes me cocodamol, but I've been to pain clinic for what use that was. It wasn't no use at all. I didn't find it helpful. And I have heard there's a painkiller injection that you can be given every few months, but for some reason, my surgery doesn't really talk about that or gives it up. They're just happy to feed me my cocodamol. So I'm just wondering if there's any advice where there's a way of asking my GP or even the practice nurse, if there's a way of getting this injection, because a relative of mine's had it and they live in another area, and they said that they've been getting it. They get it every few months, this injection, and it's a lifesaver. So I'm just wondering, how would I go about getting that painkiller injection rather than keep having cocodamol, which makes me rattle with amongst other medication I'm on? Thank you.
Lorraine, if I can, before you, Beth, and your colleagues decide to go, I guess, Lorraine, one thing that you can definitely explore is, obviously, we don't know what your medical background, or we're not medical professionals as well, but we definitely know that you have the right to ask for second opinion. So you can ask to be seen by another GP, another doctor, to be referred to a service, and this may change things. But again, it really depends on what your medical background is.
Yeah.
Yes. So
I get that.
definitely
Okay, thank you.
do speak to your GP.
Well, I'm due to go there Friday, so I can chase it up there, because I was going to ask the last few visits. I haven't. I mean, my cancer side of things is under Barts Hospital, nothing to do with my GP at all. I go every other month for oncology, but it was a bit of a shock. But this arthritis, my left leg I've got slight limp. My left leg is slightly longer than my right leg, which my left leg makes me 5'7", which is my actual weight. The right leg after surgery makes me 5'6" if I stand on that one. Ever since I was 13, I was amazed. They didn't think I'd walk again, but I did. But obviously, it meant I would have arthritis at a very young age, because the leg was that smashed. I had 6 operations before it worked, and learning to walk again. So I'm just wondering. I've kind of learned to cope with pain over the years, being 58 now, but the left leg is starting to feel much worse than the one I had replaced, and I may have to have a knee replacement in that left leg, but I'm trying to avoid that if I can.
Yeah, thank you, Lorraine. And maybe just to add on,
thank you.
We've got a few comments about and one question: how can Versus Arthritis assist us in accessing alternatives? Are there any alternatives that you guys can suggest?
I think on our website is a huge treasure trove of useful information, and there is a section on alternative therapies on there as well. So I think that's one key area to take a look at. And another one I would suggest, and particularly for people in Lorraine's situation, would be to connect with us via our online community. because you will find there are thousands of people who are members up and down the country living with arthritis, some of whom will be going through similar situation to yourself, Lorraine. I mean, yours sounds, particularly tough in many ways. And I would like to say thank you as well, because it's really important for us to be able to hear the struggles that you're going through, because another big piece of our work is actually we have a team who work on policy and public affairs, and they are absolutely dedicated to trying to put arthritis and the needs of people with arthritis more firmly on the agenda with government, and influencing the way decisions are made and how that trickles down into the NHS. And there's more that needs to be done. And so hearing things like this, we can then share with the policy team. It reminds us why we're here doing what we're doing. It's frustrating, and it isn't nearly where it needs to be at the moment. So thank you for sharing.
Thank you, Mel. And we don't have much time to go, really, but there are a few, all the comments really are very important, but I'll touch on a few and I'll acknowledge some. We had comments about patients not being able to see the same GP, so that's continuity of care. Different doctors have different approaches, which is an issue. We appreciate that. We also had a few questions about, I think that's quite interesting, because we heard from people who had to leave work because of the pain, and that really made them kind of disabled. They could not really continue working. And the question is, what support can workplace offer apart from physio?
Oh, I've just literally, sorry, I'll say what I've literally, ironically, just directly messaged a response back to the person who asked that question.
I think it will be
from my perspective, and I'm sure there's more than one answer here, that the corporate team can actually offer to employers through our health development team a workplace awareness about arthritis and MSK issues, and what best practice looks like for employers, and also advice for employees. So potentially there is a talk that could be given by Versus Arthritis to employers who are interested in having such a talk for their HR teams, but also for their wider colleagues.
Yeah, thank you, Mel. And a few questions about some support. Are there any special chairs, a special chair that you can recommend for chronic pain sufferers? And is there a special bed that you can recommend? Is that something that
there are many manufacturers and brands out there?
If there is one that you've been hearing from, or it's not to say that this definitely will help.
Becky,
yeah, I think I can't recommend a chair or a bed, and I think it would depend kind of on your situation and where your pain is and all that kind of stuff. But if you have got osteoarthritis of the knee or hip, people sometimes do find like a knee pillow can help. So you can buy them, or you can just put like a little pillow kind of between your knees, or you can buy these ones that come with like a strap that go kind of around your thigh. And what that does essentially is it just elevates it, particularly if you're a side sleeper, it elevates your kind of upper leg to be more in line with your spine, so it takes a lot of the pressure off your knee and your hip. So I have issues with my hip, and I started sleeping with, I just got a little kind of square pillow that I put between my knees each night, and I found that did help me alleviate some of my kind of pain when I was sleeping. Obviously not everything will work for everyone, because arthritis is very individual, but something like that, if you do have knee or hip pain, might help you. Like I said, you don't have to go and pay a fortune. You'll find some on like Amazon that are extortionate, but you could just buy a little pillow or find kind of cheaper alternatives.
It's worth saying as well, we have got some ideas on our website for other products and things that are suitable for people with arthritis. So it's not necessarily those specific ones, but you might see on there an idea of something that might be able to help. So things like, if you can't pick up the kettle, there's like a tipping kettle that you can get. Also as well, things like if you really struggle to sort of open your door, if you've got stiffness in your elbow and wrist, and your hands and things like key turners. But it's just some ideas, and you can find them anywhere. But yeah, do just take a look at our website as well. And thank you, Becky, for sharing your personal experience. It's really, really useful.
And we sometimes do spotlights on this in our Inspire magazine, which is a quarterly magazine. So we can always feed back to the content team because this is a pertinent subject. And there are also blogs on the website which focus on specific areas. I think they've recently done one on footwear. Stay tuned. Do keep visiting the website, because sooner or later we'll certainly feed it back to the team as well. When are they planning to do a spotlight on that sort of furniture aspect?
Thank you. Any more questions for Versus Arthritis colleagues? If not, then we will end the meeting shortly. We'll share the presentation with you and the recordings of this meeting by the end of next week, hopefully. If you have any outstanding questions, please feel free to get in touch with us. Send this question. We'll make sure that presenters today will get a chance to respond, and we'll feed back to you. If there are no more questions, I would like to thank you, Becky, Mel, and Bethany, for being here today. Thank you very much. Very useful information. We already got compliments in the chat as well. Much appreciated. And thank you all for joining this January information exchange. We'll see you in a couple of months.
Thank you so much. Thanks.
Thank you.
Thanks, everyone.
Thank you. Bye.
Bye.
Thank you. Bye.